Hello ladies and gents. So, spinal anatomy, what have we got? We have a model of the spine and we've got the pelvis attached to it. So, all this business about CSP and TSP and LSP, that's what this is all about. Okay, so let's have a look. Get straight to the details. This is part of the actual cranium. This is the bit right at the back of your head over here, so that's the occiput. This here is a model of the spine. Here we have the anterior and here we have the posterior. You are therefore looking at it from a lateral viewpoint. The pelvis, very quickly, you've got the pelvis. It is actually two bones. You've got the pubic symphysis over here, and you have what we call the right innominate and the left innominate. So this is actually two bones. This is why during pregnancy people can get SPD or symphysis pubis dysfunction, and it's because you get excessive mobility due to ligament laxity caused by the relaxin. So that's that over there. Rather importantly, here we have the triangular bone at the bottom. This is a sacrum. This inserts, if you look at it from a superior viewpoint, into the pelvic girdle. Okay, and this in essence forms, if I show you from the anterior view, this joint over here, and that's the anterior aspect. You've got ligaments over here, the anterior sacroiliac ligaments, and then on the posterior view you have this joint over here. This is the sacroiliac joint again. This is a posterior aspect, and of course you've got the posterior sacroiliac ligaments. The actual spine itself is split into its relative segments. In the upper region we've got C1 to C7. C referring to cervical. This is the same cervical as the cervix, but do not confuse cervical and cervix in that respect. Medical terminology, otherwise on the notes you will see CSP as a denotion, and generally we will see C1, C2, C3, 4, 5 and 6 and 7 of course. Then we have the T-spine, TSP the denotion, and we've got the T-spine going T1 to T12. So we've got 12 segments in the T-spine. This is the thoracic spine. And then finally we have that lumbar spine, which is the lower back as such, L1 to L5. So we've got 5 segments in the lumbar spine, so L1, L2, L3, L4 and L5, and LSP is your denotion there. In the sacral region, you've generally got 5 segments to the sacrum, and that's S1 to S5. And then right at the bottom you've got the tailbone. This is called the coccyx. Coccyx. Now we don't generally go into the coccyx. Pain in the coccyx is diagnosed as being coccydynia. The sacrum itself is fused, there is no motion on that at all, as is the coccyx, but the junction between the coccyx and the sacrococccygeal junction is mobile of course. The lumbosacral junction, the LS junction, we have here the TL junction, the thoracolumbar junction, and at the top over here, just at the hump over here at the base of your neck, just this region, we have the CTJ, the cervicothoracic junction. And then right at the top, so just referring back to the C1 to C7, the cervical spine, generally when you look at somebody's side on, if I demonstrate myself a little, you'll see this. You can see from a side, you can see that the neck goes inwards, and then my upper back is curved outwards like so, and then my lower back is curved inwards. And this is generally what we should see. So these are normal curvatures of the spine. It's what we call AP curvature of the spine. And what you should see, again, this is the anterior view on this side, posterior on this side. This is what we therefore call the cervical lordosis. They should sit somewhat like this. We then have the thoracic kyphosis, and we have the lumbar lordosis. Okay, sometimes they can be accentuated, and so you can have what we call hyperkyphosis in here, hyperlordosis, and hyperlordosis in the lumbar spine if it was like so. Now this of course predisposes to certain conditions. Generally those of Afro-Caribbean ethnicity are more so angulated like so, therefore the predisposition to issues at the lower back is significantly greater, issues such as spondylolisthesis. Very quickly to mention the C1, C2. The C1 is not exactly a true vertebra, and there is no disc between the C1 and the occiput. Okay, the C2 is also different because it contains a segment. I will do a video on the abnormal vertebrae and why they are not typical vertebrae, so the atypical vertebrae. So we'll be able to get a good video on that. The spinal cord, very quickly to mention also here, the spinal cord runs, you may refer to my video on the actual vertebra itself and its anatomy, and you can see the spinal canal in that. Just remind yourselves, here we are, we've got the spinal canal running, the spinal cord running through the spinal canal. If I open this up, you can see there's a tubing there. Remember from the previous video again, this starts to terminate at the T10 vertebra, and then by the L1 it's pretty much all gone. It's a conus medullaris in that region, after which it becomes a cauda equina. For this reason it is that when we do a lumbar puncture, so if the patient is lay on their side like so, you get them to flex at the knee, so bring in a very fetal position, curled up, and you will go into the lumbar spine from there, and therefore you are not going to hit the spinal cord at all. Rather, you may hit one of the spinal nerves but not the spinal cord, and it's for that very reason that we do the lumbar puncture in the lumbar spine, because or below the L1 region, because you know, of course, going to pierce the spinal cord, given that there is none there. I hope that helps. Thank you for watching.